COVID time, COVID time 2021. Active Researcher and Best Paper Award was in the year of 2015. Madam developed SOP for Siloma Hospital, Indonesia, and man got first prize in ECG interpretation as well as appreciation certificates, medical relief education camp, and Punjab DO education innovations. National Institute of Disaster Management. Also, Madam involved in e-learning programs and organizing national and international CNEs. Madam is authorized for 3 books and 3 information booklet and contributed to 11 chapters in different books. Now the session is handed over to Madam for the interesting session like ethical consideration and report writing. Now the session is handed over to Madam Jyoti Kathwal.
Thank you so
Welcome you,
much.
ma'am.
Thank you so much, ma'am, for the kind introduction. I hope my screen is visible.
Yes, ma'am. Screen is visible.
Yeah. So a warm welcome from AIMS Bilaspur, and at the outset, I would like to thank all the team of NTI. Special thanks to Dr. Priyanka and her team for inviting me and giving me an opportunity to be with you all. And as this is the last session, so I hope you have learned a lot already. So we'll just brush up what all things you have done, and we'll just add little bit what all things to be done in ethical part. But before we start, I would like to ask you if there is a patient, and as a nurse, I'm working with that patient, and patient has given us a DNR. That means do not resuscitate form he has filled, and suddenly patient is collapsing. And as a nurse, I am not resuscitating the patient, but relatives come over and they start fighting with me and they tell me, why are you not resuscitating the patient? I am the next kin. I am authorized to take decision on my father's behalf. So what should I do? Shall I continue with the resuscitation or I should not because patient has signed the DNR? Would you like to share some thoughts on it? You can share your views on chat. Is it ethical if I do not give resuscitation? Just say yes or no.
Dear participants, you can share your views regarding yes or no. We should proceed with the procedure or we should not. You can type your views in the chat box. No one is judging you. Simply, it's interactive discussion actually. So I request all my dear participants, kindly type in the chat box. Very good afternoon, Miss Nivedita. You can drop your suggestion here.
So what I feel is this is a ethical situation where you need to take a decision. Yes, somebody said yes, you should not do the DNR. Another one. So because patient has given us, yeah, I am getting the yes more. People are responding as yes. So I feel DNR is already signed by the patient. So it is the will of the patient. So correct. So we are not supposed to go against the will of the patient because he has already given us a document which says that he is not supposed to be resuscitated. So this type of situation when it comes, whether to do right or whether to not do it, that is ethical situation. So this is where we say ethics comes in picture. Now, the topic which is given to me is something related to ethics only, but this ethics is more related to your research part and report writing. So what are we going to talk in this session is what is ethics, what are the ethical considerations and why are they important? Some ethical principles also. Then we'll switch to the part B, that is report writing and how we have a good report writing ethically and ensuring the objectivity and accuracy in the research reporting. As we discussed just now, that ethics is moral principle, whether I should do, whether I should not do. So what gives me the authority to take that decision? The best interest of the patient. If I want to save the patient, if I want to do good for the patient, this is what my moral principle will help me to take a decision, and overall it is called ethics. Now, as it is written, what is good, what is wrong, what is right, what is not right, this is justification between what is to be done is known as ethics. Now, there is a slight difference between ethics and morals. According to my understanding, I would say ethics is individual based. Now, I would cite an example. If I have if I have not taken the vital signs of the patient and I'm charting it, but I feel it's okay, patient ठीक ही तो है, doesn't matter. So it is a ethical situation. It is an individual decision which I'm taking for the patient. It might be wrong, it might not be wrong. So whereas moral is community is deciding, like everybody should respect elderlies, everybody should respect women, you should be more dignified when you are in professionally. So that is more community based norms. So this is the basic difference between ethics and morals. Now let's move to the next part, that is ethical considerations. Ethical consideration is very much important when we are talking about the research. It is about finding reasons. Now, what kind of reasons? What whether to do right or not to do right. So choosing what is right and whether you want to believe it, whether it is good or no. As I gave example, charting without taking the vital signs, it was okay with me, so it is okay. So it means individual thinking, but it is not applicable in research part because different participants are there. You have possibility of harming the participants, and you have to maintain dignity of research participants. So therefore it is very much important when we are doing conducting research, ethical considerations are taken care of. Now, why ethical consideration is important? It is because the what is the aim of the research? To add knowledge, to add truth, to avoid any kind of errors. And ethical principles or ethics helps us to uh, go towards this knowledge, truth, and avoidance of error in a very objective manner. And it also prevents any kind of fabrication of your results. Let's say I did some research, but my results are not coming as per expectation. I should not change it. That fabrication should not be done. That is ethical consideration coming in, falsifying, misrepresenting. All this is reduced when we are following ethics. And it also promote the truth and minimizing errors. Now, coming to the principles, the first principle is autonomy. Autonomy means the participants have the right to say yes or no. I cannot force anybody to participate. They can do the decision making. In between the study also, they are allowed to get relieved or not participate in the study. Justice means if I have two types of participants, everybody is taken care as equal. No bias or no, I would say, partial treatment is given. Beneficence and non-maleficence, I think everybody knows about it. We are doing good for the patient or the participants, and we are not harming the participants. Informed consent, as the statement, it is self-explanatory. That means people who are participating, they should be informed what is positive, what is negative, what are the risks, what can be the discomfort. All those details, all purposes of that research should be shared with the participants. Integrity means I am not fabricating, I am not manipulating anything, I am not doing what is not supposed to be done. Then conflict of interest, this comes in picture when I have some ulterior motives like somebody sponsored my research. So I want to show that this is positive. I would cite an example somewhere in COVID time. Lancet did this type of study. They promoted that the vaccine is good. So they sponsored it. So the results were brought in favor of Lancet. So this was kind of a conflict of interest. Confidentiality and data protection. This is again self-explanatory. Whatever information I'm gaining from the study participants, that should be kept confidential and should be protected. It should not be easily accessible to anyone other than the researchers or the principal investigator. Now, before I move forward, I would like to show you one video and I want your input from it. I don't know. Not playing. Anyhow, we'll move next. Now, there was a study done in uh, second during the World War Second, the state Ville Penitentiary. What happened during that time? Malaria outbreak was very high, and females, especially the female participants who were in the prison, they were injected malarial infection, and different type of drugs were assessed on them. So was it ethical or unethical? Did we follow the ethical principles? No, we did not follow the ethical principles because the participants were not aware what is being done to them. There was no informed consent, there was no autonomy for the study participants. Now, this was about the quantitative research. Now, what is to be done ethically in qualitative research? Because qualitative research is something where you are not quantifying. Usually what we do is we do pre-test, post-test, and we get the data. But whereas in qualitative, you go for further focused group discussions or interviews. So in that case, confidentiality is a big challenge. And also bias can come. When I am interviewing, I'm doing an interview for different people, whatever information I'm getting from the first person might affect my judgment when I'm talking to the next person. Why? पिछले वाले ने तो ये बताया था, ये वाला पर्सन तो मुझे ऐसी इंफॉर्मेशन दे नहीं रहा. So that kind of bias can come in the qualitative research. So you have to be very careful that you maintain confidentiality and refrain from any kind of bias. Now let's talk about how can research be ethical. Now, according to NIH, there were 7 principles which are being given. First is the social and clinical value. Whatever research I'm doing, it has to add something, whether it is for the society or for the clinically. So you have to always add to body of knowledge. May, as it is written, if a study involves any kind of discomfort also, that discomfort should be higher than the benefit or the outcome of that research. Now let's understand this with the example. A nurse who is taking care of patients of diabetes observes that patients are having pressure ulcers, and she comes up with a research where with minimal skin irritation, she is able to prevent pressure ulcer. So here she is able to provide clinical update. Secondly, a mild irritation is okay as compared to pressure ulcer. So the benefit is higher as compared to the risk. So this is what is social and clinical value. Moving to the second one, this is scientific validity. Scientific validity means it has to have a clear and useful answer. Like in previous example, we discussed that nurse is doing it for the for the betterment of pressure ulcer. So there is a useful answer coming up. But if a nurse is doing a study on hand washing and she is not she has no data related to the infection incidence or the infection rate in the hospital, and she has thought of that I would do it on infection control, but she has to delineate what kind of infection she is addressing, whether it is ventilator associated or it is related to central lines. So that kind of delineation has to be done. So, and how many nurses we are going to, so that way it has to be scientifically validated, and method should be correct, and we need to properly follow the rules and steps of research. Next is fair subject selection. As we said that we have to take the informed consent, we have to give them autonomy for participation. But as a researcher, I also have to choose right people. Now, how do I choose? I have to have some, everybody knows, I think in the participants that we make a inclusion and exclusion criteria. Now, if I refer the example here, a nursing study which a new method to reduce anxiety is assessed. Now, if this nurse only takes men, will it be ethical? No. She has to recruit all kind of patients, whosoever is coming, but it has to address the purpose of that research. So, apart from that, risk of participating should also be discussed, and what are the benefits should also be stated, and anybody can leave in between, that is also allowed. So subject selection should be very fair and unbiased. It should not be selectively done that my now if I give another example, I take first year and second year, and I assess the knowledge related to MI. So who will have a better knowledge? It's obvious. Second year will have better knowledge because they have already learned about MI. So in that case, my subject selection is not ethically or incorrect. Moving to the next one, that is favorable risk benefit ratio. It means the risk should be lower as compared to the benefit. Risk can be anything. It can be small, it can be serious, it can be long term, short term, emotional, financial, anything. But it has to be addressed. And that risk should be lesser than the benefit. Now, as a researcher, you have to make sure that whatever risk is there, it is minimal and there is no discomfort, or if it is discomfort, also very minimal, and it is always increasing the benefits. And looking at the example here, you can see a nursing study involves ICU nurses. Apart from, let's not talk about hospital. Now, if I talk about that there is a research, phenomenological research done on females who doesn't have children. So if I'm asking the question, and that will make them uncomfortable. Secondly, I would also seek the family support. So that will again also cause risk of emotional stress. But what am I trying to find out? I'm trying to find out that what is the reason for them to get stressed and how can I help them so that this will reduce their stress. Plus, I would also give them opportunity to get counseling related to the infertility or whatever reason for them for not having children. So that way it is risk benefit ratio should be appropriately addressed. Next one is the independent review. I think everybody knows about it. Whenever we are submitting any kind of research to our institution, there is a review of it. Now, what is the purpose? Now, this has to be independent review. It is not like कि मेरे teachers हैं या मेरे guide हैं उनको ही देना है review के लिए. It should be independent. It should be people who are not relevant to that study. Now, why are we doing it? Because it removes the bias. Many a times you must have experienced, many a times when we are busy in calculation, we do 2 plus 2 as 5 and we are not realizing it. So somebody else can realize it quickly because they are not involved in that thought process. So for that reason, it should be done from independent reviewers. And what are we assessing? We are assessing the risk for the participants, whether it is done in ethical way and safe way. And whosoever is in the review board, they keep an eye that research is done in a ethical and there is nothing uh, nothing will go wrong in it. Next one is the informed consent. When I'm talking about informed consent, I think since first year of our BSc nursing or nursing career, we have learned about informed consent. Now, in informed consent, I have repeatedly saying that they have to make their own decision. They can leave in between, but as a researcher, I have to give them accurate information about the purpose, methods, and what all interventions are involved, and how it is related to them. If I am taking a diabetic patient, how is it related to them? I cannot take a participant of MI for a diabetic study. So clinical situation should be relevant and it has to be voluntary decision. Lastly is the respect for potential or enrolled subjects. So whosoever is going to participate in my study, they have to be respected. Their privacy is respected. Their information is not going to be shared with anyone. They have to say right to say no. They can change their mind. If they are giving me consent today, they are not bound to follow me for whatever duration I am going to do the research. They can withdraw anytime. And if in case I am finding something new or intervention is not going in the manner what I expected, so I have to update the new information to participants. And I have to monitor their health and safety. If I'm observing that their safety is at stake, I have to stop the intervention for them. It's not like my research should complete. No, the safety of the participant is first. Now, related to this, I would like to ask you another question. There was during Second World War when Nazis or German soldiers, they were having a lot of infection in their wounds, and they were getting sepsis in their wounds. So what doctors came up with an idea that whosoever is in the prison, there they created wounds by beating or whatever is the way, and then they infected the wounds with different. They would put some debris, they would put some dirty water like that, and then they would assess what kind of antibiotics are useful for them. But in this prison, the prisoners were not aware why it is being done, what kind of medications they are being given. So that consent was not taken. So which is totally a unethical practice. Now let's talk about the second part of our session, that is ethical consideration in report writing. I think majority of you must have already done report writing. You must have written your dissertation or thesis or any article. Now, first thing that we do is we follow honesty and transparency. It is not mandatory that my research, whatever intervention I've thought, it has to work. It may not work. I am trying to find out whether it works or doesn't work. So it is not mandatory that you have to show positive results. So you have to be very transparent what happened during the research. So accurate, objective, and honest information should be shared in research. No data fabrication, falsification, or misinterpretation. Another thing that I have observed many times that people do a research, then they save one part of that data. Now, for you to understand it easily, let's say I have taken pre-test, post-test, and I'm sharing whether my intervention is doing good or no. So I've just published the article that it is only the efficacy of that intervention. But I'm not writing about the association with the socio-demographic variables. I'm not showing the any correlation between knowledge, attitude, or whatever. I'm showing only the efficacy. So that is part of it. So that is redundancy. That means part of it I have done it today in this report, and I'm doing it for the another. So that is again a misinterpretation and an unethical practice. Next one is the anonymity and confidentiality. Anonymity, as we all are aware, whosoever is participating, we are not going to share their details. So their identifiers are not published or not written in the report. They should be removed. And if I have to do so, I must take an written consent. Many a times that happens that there is a very unique case that I have to report. So that time I will have to take a proper disclosure or a consent from the participant. And confidentiality again has to be maintained. Then plagiarism and intellectual property. This is quite interesting because these days we have many softwares where we are getting the details, but that those softwares may or may not give you right information. So you have to be very careful. You have to properly cite whatever information you are gaining from internet or secondary literature or any kind of literature. You have to acknowledge from where you have taken it. That will avoid plagiarism. Because if I'm not citing it, if I'm not giving credit to that body of knowledge or the literature, then it will be plagiarism. And whosoever has contributed, let's say three people were there, two did the data collection, one did report writing, somebody else did about tool preparation. So in that case, intellectual contribution should be given proper credit. If I'm stealing from someone else, it is not ethical and it is again plagiarism. And ethical report, when we are writing, it has to have correct citation and paraphrasing. Because whatever we are writing, it cannot come from vacuum. It is always from the available resources. We are coming from one known to unknown. It is not that out of something and out of blue I'm getting the idea and writing the thesis or anything. Not that way. So you have to use paraphrasing so that you give proper credit and proper referencing and citation. Majority of time we use APA or Vancouver style. Now, again, I would like to pose a situation that a survey which is conducted for collecting the data and without anonymity we are collecting. Is it right? No, it is not ethical. We have to maintain the anonymity. Next part is the confidentiality and privacy. So that is why anonymity is important. Manuscripts see, we always write different kind of articles, or we give our chapters for assessment. So in that case, whosoever is reviewing should keep it as confidential. I have seen in my career that people just, when you send the tool for validation, people just copy it and they publish paper based on your tool. So in that case, you have to be very careful whom you are sharing your details, and it has to be done on a right platform. And ethical consideration will always protect your work, and it should be maintained as confidential. And in case breaching in the confidentiality occurs, then it is a legal repercussions which can happen. As I mentioned earlier, we have to avoid bias. If I'm doing an intervention efficacy, it is not necessary I have to post my results as positive. If it's negative also, research is valid. So ethical reporting should be objective. Objective means quantified. If it is a qualitative also, I should make a conclusion that this is the majority opinion. So it has to have be very done in a very neutral way, and very consciously you have to avoid bias. Another thing that whatever I'm writing in my ethical report, I'm correlating with the available literature. So that is based on the different researches, and I have to acknowledge them, and I have to acknowledge my limitation also. As I mentioned, if I'm not able to get the positive result of my intervention, I would share that because there was a time constraint or I had less number of uh, participant, that was a problem. So it is not mandatory that you have to go for a bias. Coming to the sixth one, that is accountability and authorship. In authorship, it is the person who is preparing it, but there are many people who are involved, and sometimes your uh, senior may say, I have your, or I would say HOD may say that mera naam to hai hi nahi, so I will not approve your thesis. So in that case, that is known as ghostwriting or awarding authorship. This is totally unethical. If it is done, it is totally unethical, and you have to follow the ethical guidelines. And significant contribution should be definitely given credit. Whosoever helped you, whenever we are writing, we are now writing the acknowledgements. So that is the reason we are writing acknowledgements, because we want to give them the accountability and the authorship about research. Next is transparency. In transparency about what? About the funding and conflict of interest. As I gave you the example of Lancet, that company funded the study, so their drug was given as a good one. So that should not be done. So you should clearly disclose if you have any kind of sponsorship. Because when I'm giving the clear details about sponsorship, then it totally clarifies the conflict of interest. If you have not done it, again, it is unethical. Lastly is about the ethical review and approval. Definitely whatever we are writing goes to a ethical board. An ethical board ensures that whatever you have written is a rightful way, it is dignified way, and participants are being protected. And there is no falsification or fabrication of the data. You must have learned about type 1 error and type 2 error. Those are unknowingly done errors. But if we are doing those such type of errors, again it is unethical, and we are not supposed to claim for the others' work. Now we move on to the next part, that is best practices for ethical report writing. For whenever we are writing a report, we are research report, we have a structure of it. That means there is a format for it. So as you can see in the picture, there is a title, introduction, methodology. All these things will be covered in your research. So whenever we are writing, we plan the structure in different clear section. And majority of the times, these structures are already preset. And about the data handling, you always use only reliable and validated data. If I'm using a tool, it has to be validated. If I'm referring somebody's research, that has to be reliable. And we are presenting the data in a very truthful manner, and retain your raw data. Whatever tool you have used and participants have given you information, that should be retained, because anytime it can be counter checked, or you may have to refer it later on. Then writing style, writing style is majority, it is second past tense because we have already completed the research, and it has to be clear, concise, and neutral language. And we always avoid any kind of jargon or complex sentences because the researchers who are going to read about it, they should be able to understand it easily. So that is the reason we organize it well, and we always use bullet points or list for easy understanding. Then objectivity and accuracy, as it is a concise part of what we have done over years or in stipulated time. You have to be very objective and stick to the purpose or objectives of your study and avoid any kind of personal opinion. And whatever I am claiming, let's say I say my ECG intervention was effective, but was it effective in other studies also? So I will support it by different other research work also. Now, after that, you have to review and revise. Many a times you write your report, and after that, you just, I would say, sleep it over. Leave it for one night and read it again, or after 2, 3 days. Then you will have a better clarity. You will understand what kind of flaws is there in it. Because when we are doing it continuously, our mind get saturated. Then is confidential and privacy. I think we have talked enough about it. You have to maintain the anonymity and remove any kind of sensitive information if it is there. If it is applicable, then you have to take authorization or consent from the participant. Then is transparency and accountability about whatever had happened. Now, I remember during my post-graduation, one of my classmates, she did a phenomenological study on one disease condition where she could only get 30 patients during that stipulated 8 weeks time. So that was her limitation. Though her sample was 75, but she could only get 30. So that's limitation she had stated when she was writing. And these uncertainties we cannot predict in advance. So you have to disclose these details. And if you have any kind of conflict of interest or funding resource, that should also be stated. Again, ethical peer review will be done. Whatever I'm writing, this will be again sent for peer review, and whatever suggestions or feedback that you come, that can be reviewed and revised. And lastly, publication will be done. And we always avoid any kind of unpublished material. Now I'm remembering one more thing. When we are using different softwares, now let's talk about ChatGPT itself. In ChatGPT, if you say that show me different kind of research articles on pressure ulcers, it will give you 150 results. But are they authentic? No, they are not authentic. You have to verify each and every resource in Google, and you will find out that 90% of the data is not there, not authentic. So whatever information you're taking, you should counter verify. Now, coming to the last part of our discussion today. Now, as a researcher, how can I make sure that my reports are accurate and objective? As I mentioned, ChatGPT is there is to support you, is not to replace you. So use only reliable and credible resources. If you go for PubMed, you will find credible resources, Scopus also, even Google Scholar also, but do not rely on uh, resources which are not reputed or authentic. Peer review journals are very good in source for information, and it helps you or to ensure the data and facts in a very trustworthy manner. Then fact checking, as I said, cross referencing. जैसे मैंने कहा chat GPT, you have to cross reference. You have to check the facts whether it is right or no. So you verify all the data statements, and multiple independent resources should be used when we are writing, because we do not want to spread any misinformation. So if we do not do so, then my credibility as a researcher goes down. I might have 2000 papers published, but everybody would know that this is not a quality research. Then present your information in unbiased manner. I think this is self-explanatory. You'll be able to, you should be able to remove your personal opinion. No bias should be involved. Distinguish between the facts and interpretation. And clear source attribution. That means from where I have taken this matter, I should give full credit. I should cite all the sources. The more I cite, the more authentic or valid my research report becomes. Why it is needed? Because when readers are reading, they will also go to the source of that data, and they will also be able to gain additional information, because I am writing that information which is suitable to my research paper. But the other researcher may have different point of view. So they want to explore that. So then they can go to that resource and identify. This increases your credibility. Then transparency in methods. Whatever I have done, I should be very transparent and allow others also to evaluate the objectivity. So whatever I have done, if I'm writing the limitation, as I mentioned, only 30 patients, so then it shows that I am not a biased researcher. I am giving all details unbiasedly with a transparent manner. Peer review, again, yeah, it gives us the feedback, it gives us proper identification of different errors. If we have written some bias also, that can be identified and that can be revised. It only helps us in the improvement for any kind of accuracy and objectivity. Now, thorough editing is required whenever we are writing. After that, it is always mandatory to read your report, because many a times there are grammatical errors and many a times there are inconsistencies. I might be writing it with a full 100% of my concentration and intellect, but they can be biased language. They can be inconsistency. Like I am talking about age, then I'm talking about marital status, then I'm again talking about age. That kind of inconsistency can occur. And ensure that you go for a editing part also. And proofreading helps us to prevent any kind of unintentional mistakes. And we always adhere to the ethical standards, what we have already discussed earlier. All those ethical guidelines should be followed. So this is all about today. Ethics is knowing the difference between what you have a right to do. My right is to do a research, but what is right to do, that is ethics. So this is all about, you can connect to me for further discussion if you wish to. Thank you so much for your patient listening. I tried my level best to keep it as concise as possible. If you have any queries, we can take up and we can discuss further. Over to you, ma'am.
If you have any queries, kindly give the inbox chat. Dear participants, did you have any queries? Yes, ma'am, please. What's the query?
Participants can now unmute themselves also. They can discuss if they want to discuss anything with Jyoti ma'am. Nitika ma'am, you can unmute yourself.
So by the time you all are thinking about your queries, I would like to share. Yeah, there is a query.
No.
Yes, it is
Ma'am,
unethical if you are sharing your research report or article simultaneously in two journals. It is unethical. You should wait for the review and then only you should submit to the other. Because if, let's say, if you get accepted in both the journals, what would you do? Then it is, unethical to keep them blinded. And what I have seen is people publish their pilot study also, and they publish their research also. So that is also unethical, but people do so.
Yes, ma'am. I have one question. Like while sending the tool, while sending the to an expert for validation, like you have mentioned, like we need to be careful on that. So I can you just can you elaborate more, like how do we make sure that it is like it's not been taken, I mean, like the content that which we are preparing is not been sent or exported to somebody else, like it has been kept safe, like on that details, can you please elaborate?
In this case, what you have to do is you have to give the people who are known people. Like everybody has their credibility in the profession. Your guide would help you out to identify such people. And another thing that you can always keep a what we do say it, there is a key, digital key. Yes. If you keep a digital key, then you will identify who has opened it and how many times it has been opened. Then you'll
Ma'am,
be able to track it.
yes, ma'am. Digital geek, can you please explain more on that?
A
Because
digital
that's
key is
something.
something where there is a code kind of a thing. You must have used your WhatsApp and other softwares in your phone. So you keep one software, like अगर मुझे मेरा WhatsApp lock करना है, so I would use some PIN code. So it is something like that. So when you are sending to someone, you protect it with a digital key. And when they want to open it, they would ask you the digital key. And there is another additional feature in it. Every time they will open, every time there will be a new digital key. That can also be done.
Okay. Thank you. Thank you so much, ma'am.
गुड आफ्टरनून मैम, मेरा एक क्वेश्चन है।
जी
मैम, अगर मैं कोई भी आर्टिकल किसी भी एक जर्नल में डालती हूँ, मैम उनका कितनी बार कई बार ऐसा होता है कि 1 ईयर तक रिप्लाई नहीं आता, तो मैम उस चीज में क्या किया जाए?
See, agar it depends on me how quickly I want to get published. See, if you ask me, those who are publishing in once in a year, definitely they will take more time. If they are publishing quarterly, they will take more time. If they are publishing monthly, they will give you quick results. So it is depending on how you want to do it. अगर आप सेलेक्टिव वही करोगे जिसमें 1 साल में मिल रहा है, तो फिर तो टाइम लगेगा.
ओके मैम, थैंक यू।
So I would suggest if you want quick responses, because every peer review has almost 6 to 8 weeks time that they take. So to have quick publication, choose uh, journals which are publishing monthly. I didn't understand, Payal, when you said how do healthcare workers manage ethical conflicts when faced with unregistered or undocumented pregnant women needing care. Now, what do you really want to ask? Ethical conflicts can be n number, like whether they want to get. I really didn't understand the query.
Miss
If
Pyle,
it
you
is,
can unmute yourself and you can directly ask your query from ma'am.
if it
I
is
request Miss
unregistered,
Pyle.
sorry.
You can continue, ma'am.
If it is unregistered, like they have not registered themselves in the hospital, if you're talking about that, then I think ANM or the ASHA workers are playing more important role there. They are getting them registered and they don't have to come to the institute. They just can go to the dispensary. Unless and until there is a complication, they are not brought to the tertiary or secondary care. And ethical conflicts, what I can think of is whether they do not want to get registered. That can also be a conflict. But again, this is my morale and my ethical principle that I have to convince them that they should go and get registered. I hope, Payal, I have done justice to your query.
I have another one question. Like when we ask for the IRB boards to request for the permissions for conducting the study, like I don't know why, like most of the institutions, like they for what reason, like what are the potential reasons that they don't allow on ethical grounds, like allow the study to be conducted in that institution. So can you kind of highlight
What
or
I
elaborate
feel is
more on
that
that?
institutional review board, they are majority of the times they are in favor that you should go for some research project. The only thing that they would not allow, or they would not allow for you to continue it, that there is some risk involved for the participants. Otherwise, they just give you corrections or suggestions to be incorporated, and 99% they allowed for the conduction of research study. If there is some kind of plagiarism, or there is some kind of safety issues related, or there is lot of investigations involved, which is occurring financial burden on participants, and you don't have a sponsors, so that time review board may suggest that it cannot be conducted. Otherwise, in my career, I have not seen. They just give you the feedback, they just give you the suggestion to incorporate. If you incorporate, then it is through.
Okay. Thank you, ma'am.
I hope we are done with the query session, ma'am.
Thank you
And
so much, everyone. I'm sorry I'm interrupting you again and again.
no, it's absolutely fine, ma'am. You can speak now.
Yeah. Thank you so much, everyone. And it was quite two-way information. I really didn't expect, because initially कोई बोला नहीं, तो मुझे लगा नहीं था कि queries आएंगी. But I'm happy that everybody listened to what I stated, and thank you so much for your attention. And looking forward to meet you all again online. Thank you, ma'am.
Same here. Thank you so much, Jyoti ma'am, for this much wonderful and interactive session. Although in starting, our participants used to listen very keenly, but at the end of session, they used to discuss. And really, I'm very much happy because for these all sessions, we are getting such type of interaction from the participants also. And I found this was the major drawback in Zoom meeting webinars. Actually, sometimes when we are, I act as resource person. Sometimes I feel I'm just talking and talking and talking only. Nobody is listening, or whether they are getting the things or not. But when there is interaction, we feel so relaxed and so completed. Yes, whatever we have delivered, somebody was there to listen. And I
Yes.
can understand that how much you will be feeling satisfactory after getting this much interaction with the participants.
True.
So a big thanks to participants as well, to make our resource persons feel comfortable and make them feel complete. Actually, it is indeed a required point for resource person. And for your ma'am, what must I say? It was speechless presentation what you have prepared, ma'am, and it was completing all the manners, all the views. And they're really thankful to you because on a single call you are always ready.
Always there.
So
So if anybody wishes to talk to me, even just for gupchup, also I'm open.
Sure, ma'am, sure, ma'am. Because nowadays, na, we are having a lot of work area stress is also there. So we
Yeah.
can talk out. And when it comes to research, what I feel that Miss Pyle asked that IRB board used to create some kind of issues. Somehow in the some of the states, ma'am, it is really a problem. The research proposal has been submitted, but due to sometimes they feel healthcare institutions that their data will leak out, like they will come to know their staff nurses not having appropriate knowledge, it will leak out. Then what they will think about our institution's reputation is on stake actually.
Yes,
So
yes.
some studies, no, they used to put them in halt, so researchers cannot proceed with further things and all. So I have also seen some of the areas where the research permissions are not granted so easily.
Yeah, in
So
that case, what we can do is, the reason this problem I have also seen, when we are writing our statements, we do not
yes,
write the setting. Selected hospital also will also do. So when we are writing the in the statement itself that it is GMCH or AIMS Bilaspur, then it again gives the threat to the review board that there is something which is not up to mark will be shared. So that is
yes,
how.
that is the main point actually, ma'am. They think about because their reputation is on stake at that time. So I think we can overcome with detailed information if we can provide to them that
Yes.
we are not doing the things intentionally. We want to improve the quality and the things actually.
But nowadays, new guideline has come that review board has to, you have to go and present it. So review board will ask you question, will tell you that this is what, like what you're saying, will give us, bad name to our institution. Then that can be said that there will not be any kind of name, because I remember when the
Yes,
first batch of GMCH came up for research proposal, that was a big problem, because BSc students, MSc students, they would do in the patients itself. or nurses. So then we convince them whenever we are writing, and ethical board gave us the guidelines that whenever you are publishing, no name of the institution should be mentioned. So this is how it was tackled.
Yes, like this, we can also tackle the things. I think like this way, everyone wants the things to be tackled. They
Yes, yes.
want to be in the safe side, and we want to learn the things actually.
It's, I would say these are humans. Humans are easy to get convinced. You know?
Yeah,
आप बात करो
and it
सब.
will be win-win situation for both the researcher and for the sitting area as well. So really, thank you so much, and I appreciate your efforts in your presentation and everything, ma'am. Thank you so much from the
Thank you
bottom of
so
my
much.
heart and from the entire team of Nursing Teachers Association of India. Thank you so
Well,
much. We would like to
thank
see you in near future as well, ma'am.
Sure.
Thank you, ma'am.
Okay, ma'am. Bye-bye. Have a great
Bye-bye,
evening,
ma'am.
everyone. Bye.
Same to you. I must convey my thanks to Professor Saranya for moderating the session so nicely. And as this was the last day of this webinar series, I extend my heartfelt thanks to each and every participant of this series that you all provided your support and patiently you joined all the sessions. And I hope it was a very good series we have dealt with. And I would like to hear about the feedbacks from all of you in the WhatsApp group. Although many of you have provided the feedback, if you want, if there are some of the shortcomings can be there definitely because no one is perfect. I personally agree that there can be some of the shortcomings of this session also. So you can directly write to me also. You can post in the WhatsApp group. We will try to modify those things in the future sessions as well. And kindly type the topics what do you want to deal with in the future comings so we can plan some more sessions webinar series like this. Thank you everyone, and if we talk about the certification process, within 2 to 3 days the certificates will be mailed to you, and the recorded session will be start uploading from tomorrow on the NTI's YouTube channel. I will share the link also. You can see the recording of all the sessions, what we have done. If anyone has missed out any of the session, they can get the recordings of that. So once again, thank you everyone. See you soon in near future for the new series with new topics. Till then, Jai Hind, Jai Bharat. Thank you everyone.